Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix, Arizona. Today I'm at SkySong, which is the Arizona State University Technology Center. It was completed back in 2009 and it sits on 42 acres. So they have a lot of extra room to build. Right now they have two main buildings which house 75 companies. So think about that. From 2009 to today, in 2011, you have 75 companies that have joined SkySong, and they range anywhere from students who've received grants from the university. You have venture capital companies here. You have 3 moms who formed a large media company that's grown and grown. So you have some smaller companies moving all the way up to Quest and ADP and things like that. All these companies have an affiliation with the university, so they all have the resources of the engineering departments and the various professors and the acumen that comes from such a prestigious university. The project itself brings over $100 million a year into the Scottsdale economy, and about 25–30% of the companies here are international. So you have a nice flair there as well. The topic for today for pain management is degenerative disc disease. It's a large topic, so I'm just going to give basically an overview. Degenerative disc disease each year affects millions of Americans. It's predominantly in the lower areas of the lumbar spine, in the discs of L4-L5 and L5-S1. Why does it occur? Well, we don't know exactly. We do know that there is a genetic component to it. We've seen that in twin studies. We also know that there are some social factors, such as if you're a truck driver or some occupation where you have a repetitive micro trauma to your lower back, that can lead to degenerative disc disease. Big traumas, like a motorcycle accident, car accident, that can contribute as well, but usually it's just normal wear and tear arthritis, but unfortunately it affects people in the age ranges of say 20 to 50, as opposed to regular arthritis, which is more 40 to end of life kind of a situation, which is more weight-bearing joints, like your hip, knee, spinal facet joints. The disc itself is a lower age range, and unfortunately, there's no silver bullet with regards to treatment. By and large, most people do not need surgery for degenerative disc disease. Those options do exist. Unfortunately, the successful results are really only 50-50 to maybe 75%, good to excellent results. So when they did those studies back in 04-ish, looking at fusion versus the new artificial disc replacement, over 50% of patients at 1 year after surgery were still taking pain medication. So surgery is not a silver bullet. It can help, but wouldn't it be better if there were options that didn't involve surgery? Well, they do exist. I'm just going to run down these. One is weight loss. Less weight you have on your skeletal structure and the discs, which is the shock absorber of the spine, potentially the less pain that you have. Quitting smoking. If you can stop smoking, smoking has been shown as an independent risk factor for degenerative disc disease. You can, 1, decrease the amount of pain potentially that you're having, and 2, prevent further disc degeneration attributed to the smoking. Can't be stressed enough, smoking doesn't really do anything good for you. It has over 400 carcinogens in the smoke itself, with all the tar and crap like that. Moving into physical activity, aerobic exercise such as swimming and bicycling has been shown to have very beneficial effects for the lower back as far as degenerative disc disease goes. It can help, 1, prevent it from occurring, and 2, prevent it, like stopping smoking, from getting any worse. And it can actually get it better as well. It can help strengthen up the muscles around the abdomen and the low back. Same thing that physical therapy can do with regards to lumbar stretching and strengthening, and they call it core. This is your core stabilization. The more the muscles are built up and ready for action, the less stress on your spine itself, therefore the less pain potentially the patient is going to have. So those types of things can help dramatically. Chiropractic treatment in conjunction with spinal decompression therapy. A lot of information on our website about that. I've got some articles and videos as well. There's some good science to back up spinal decompression, and it's over 75% good to excellent results as well. In conjunction with the other options that we have at Preferred Pain Center, the results get up to about 90% good to excellent. It can be very helpful for avoiding surgery. Degenerative disc disease patients that have back pain every day, I mean, it affects their ability to sleep, work, socialize, play with their loved ones, maintain a happy, successful marriage. These types of treatments can really be extremely beneficial. As a last resort, you're moving into interventional pain management, or medications may be in conjunction with that. These medications might not be narcotics. You might be talking about anti-inflammatories like Advil, ibuprofen products, Tylenol, maybe Ultram, something like that, which is a non-narcotic pain medication. And then you move into the pain medications, like the Percocets and things like that. On a chronic basis, which is usually what we're talking about with degenerative disc disease, chronic narcotics are not a great idea. They have problems. They can cause depression. They can cause constipation, tolerance issues, withdrawal. Best to avoid them if at all possible. Interventional treatments that can help. If the patient also has facet disease, those little joints around the spine, injection into the facet joints can be great. If it's the disc itself that is the problem, then a procedure called a nucleoplasty has been shown to have about a 60 to 65% good to excellent results. And that is involved with numbing up the skin, maybe giving a little sedation, and going into the disc itself with a needle and basically applying a radio frequency energy, which then takes away some of the disc, creates a little bit of a vacuum, decreases pressure in the disc space, and can relieve pain. And then over the course of the next few weeks to months, hopefully the molecular bonds that were destroyed grow back in a better shape and fashion so that pain is decreased, and like I said, 60 to 65% beneficial effects. That's an overview of the treatments for degenerative disc disease. Overall, it's best to avoid surgery, and these treatments either in conjunction or individually can help you do that. Check out our website at preferredpaincenter.com. Also, preferredpaincenter.com/blog is a very active blog. A lot of educational videos and animations on our site. Call us today for an appointment at 602-507-6550. We take most major insurances. We work on personal injury liens as well as self-pay. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.